Hello everyone, I'm excited to share some great news. Dr. Sharanda Gunn-Nolan has accepted the position to serve as our Market Chief Medical Officer. This position has been vacant for several months and we're excited to have it filled again. Sharanda is not new to Sova Health. She joined in one of our earliest classes as a resident and stayed on to be a hospitalist afterward. She's currently serving as the Program Director and was recognized by Apogee as the Program Director of the Year for all of their hospital medicine services across the country. She's also participated with us in our COVID unit. She helped us as the first physician taking care of our COVID patients, helped us establish our protocols for safety, for our employees, for our physicians, and keeping our patients safe and improving in health. Dr. Gunn-Nolan also will lead a new series of videos that we want to be distributing talking about COVID. There's a lot of information out there and some of it's contradictory information. So we felt that it would be helpful for Sova to be presenting to the community some subject matter experts, physicians talking about our condition currently in our community around COVID. And she'll be talking to you more about that specifically. As the Market Chief Medical Officer, she'll serve both campuses, Danville and Martinsville. And so Dale Alward, our CEO on the Martinsville campus, will talk to you a little bit more about the role of a Chief Medical Officer. Thank you.
Thanks, Alan. We're certainly pleased to announce and welcome Dr. Gunn-Nolan as the Chief Medical Officer for Sova Health System. Incorporates both Sova Health Martinsville, Sova Health Danville. Very happy to have Dr. Gunn-Nolan coming on board. The CMO is a linchpin really to tying together all of our quality initiatives, our patient safety initiatives, anything clinical excellence related. They are a key part of our senior executive team. They are a key part of our senior medical staff leadership team as well. And we all sit around the table together, obviously, to work together to make our communities healthier. So we're very excited, very happy to have Dr. Gunn-Nolan coming on board with us. And now I think she's going to say a few words, and then Dr. Gunn-Nolan's also going to talk to us a little bit about information about our new physician-led COVID update series that's coming out. So with that, welcome Dr. Gunn-Nolan, and thanks to have you, and great to have you on board.
Thank you, Alan and Dale. I want to introduce myself as Dr. Gunn-Nolan. I'm a familiar face to many of you, and I'm so happy to have accepted this position as the Chief Medical Officer for the Sova Market. I get asked many questions these days as medicine as we know it has completely changed. One of the questions I get asked is, why did I become a physician? You know, that's a different story for a different day that maybe during lighter times we can share. At this time, I think our biggest role is to give information to you at our current status with COVID. There's information overload for many of you, and I think we need to narrow down what becomes important for this community. Right now, between both campuses, there's 30 patients approximately in-house. I do want to reiterate that our staff has all of the equipment and capacity that we need to continue to manage these patients. I also want to make sure that it's imperative if you are needing medical treatment, you are not delaying coming to the hospital. This has been a worldwide issue and patients are suffering from other illnesses and conditions because they haven't sought appropriate medical care. We want to make sure that people feel comfortable and safe when coming into our facilities. It's also imperative that you do know our community numbers are increasing. Because of this, we are reviewing our visitor policy at this time. The CDC has placed recommendations and we feel it's important to follow those. There may be changes to our visitor policy soon, and we will make sure we communicate those as we make them final. I also want to make sure everyone knows that there are simple measures that can decrease our community spread. Wearing a mask and simple hand washing becomes so important. When you're in public and in other facilities and within our community, wearing a mask decreases transmission. Remember, that mask is not to keep you safe. That mask is to ensure that you are not spreading as an asymptomatic carrier to other patients if you happen to be infected with COVID-19. I do want to say thank you to this community for accepting myself, my husband, for the last 8 years that we've been here. I look forward to continuing to serve both campuses in Martinsville and Danville. Thank you.